This segment of Delmarva Life is brought to you by Delmarva Chiropractic.
It's a way of life for so many people. The alarm goes off, you step out of bed, and you feel it, that aching pain in your back.
You know, it's absolutely debilitating. In fact, Global Burden of Disease reports low back pain is the single leading cause of disability worldwide. 1/2 of all working Americans say they have back pain every year. So it should come as no surprise that back pain is one of the most common reasons for missed work. Experts believe as many as 80% of the population will have back problems at some point in their life. Now, sometimes you can pinpoint what caused the back pain. You know, I remember one day I was doing yard work for my grandmother, lifting heavy bags of dirt, a lot of raking, and then just a simple turn tweaked it.
Yep.
I was down, I was out, I had to call my mom and sister, say, come pick me up, I can't move. It was horrible.
Goodness. Well, that's one way to do it. And another way, sometimes when I just work out too much in the gym, you know, I get that back pain as well.
You know, there are many causes of back pain. Some you may have never even considered. Here are 6 secret causes of back pain.
This is stabbing pain.
Aline Eckert doesn't know what caused her back to start hurting, but like 45% of all women, she suffers from back pain that has persisted for years.
And it just got more and more painful.
Professor of Physical Therapy and Orthopedic Surgery Linda Van Dillen says there are stressors that can set off back pain that have little to do with your back.
Smoking changes the circulation, and circulation contributes or gives nutrients to all of the structures in your body.
Your mood can make you ache. A recent study published in Pain magazine shows the odds of having lower back pain were 1.6 times higher for subjects with symptoms of depression. Anxiety can also be a culprit.
People who are anxious tend to use their muscles more, contract them more, and that can cause pain.
Other problems can mask themselves as back pain, like a urinary tract infection, appendicitis, or kidney stones.
Serious condition could be an aneurysm of the aorta, which is the vessel that supplies blood to the lower extremities.
Even what you wear can have an impact.
Clothes can cause or can contribute to back pain symptoms if they're very restrictive. So, for example, people who wear tight jeans, who can't move their hips very much.
And ladies, heels higher than 3 inches put 7 times as much pressure on your feet, disrupting your center of gravity. 2 simple words that Dr. Van Dillen says can help.
Stay active.
Even if your back hurts, the more you move, the better it will be.
Also, slouching puts an extra 100 pounds of stress on the lower back, resulting in muscle fatigue and the onset of back pain. And get this, for every inch your head drops forward as you're slouching, the stress on your spine increases by 10 pounds.
Wow, so get those shoulders back, sit up straight. But we're not just talking about adults here. Our kids can put quite a bit of strain on their back too, particularly during this time of year.
Yeah, that's because they're lugging around their backpacks. I mean, have you ever picked up one of those things? I don't know how some of them carry them all day long, but it's not just the weight of the backpack that can cause harm, but also how they carry it. I spent some time with the folks at Delmarva Chiropractic to find out how to prevent back pain.
If you're looking to move something from point A to point B, chances are you'll have to carry it. But at what cost to your body?
Carrying things is one of the most common injuries to the spine or the major extremities of the body.
Dr. Kevin McCamey with Delmarva Chiropractic says children are not exempt from these types of injuries. In fact, as many of them head back to school, the very bag they use to carry their books could be harming them.
Over 5,400 children were treated in emergency rooms in this country last year alone for backpack injuries, and about 60% of the children carrying backpacks are carrying too much weight in the backpack.
So how much is too much? Well, the American Chiropractic Association recommends that a backpack not weigh more than 10% of a child's body weight. Anything more than that, and Dr. McCamey says, you could be putting your child at risk.
The first and foremost thing that happens is children are carrying too much weight, and so they're not able to walk correctly, so they trip and fall. Most of the injuries come from stumbles, and they fall with the backpack on top of them. And the falls can cause fractures or even other injuries to the spine.
Another cause for concern is not wearing the backpack correctly.
Loading one shoulder unevenly and placing all of that weight on the one shoulder, compressing the structures of the shoulder and stretching out the muscles of the neck and causing damage to the nerves.
That's why Dr. McCamey says it's important to wear the straps over both shoulders, with the weight evenly distributed.
Shoulder straps being worn incorrectly across the shoulders and shoulder injuries, or compression or traction of the small nerves that run from the neck underneath the shoulder blades and out to the arms and the hands. It can cause pain in the shoulders. It can even cause numbness and tingling in the arms and hands, and some, in advanced cases, could cause weakness in the child's hands.
Last but not least, Dr. McCamey says to make sure the straps are tight enough so that the backpack hangs in the middle of the back.
Wearing the straps too loose can lower the center of gravity to the child's rear portion, so can put it more towards the hips, and then they have to bend more further forward to balance that weight out.
One way to tell if your child's backpack is too heavy or they're not wearing it properly is by simply listening to them.
80% of the adult population will have back pain during their lifetime, but children should not complain of back pain at all. And it's very uncommon for children to have back pain that lasts more than a couple of days. So anytime your child is complaining that their back hurts, then it should be a sign to take a look at what's going on.
Believe it or not, Dr. McCamey says about 1 in 4 children complain during the school year about back pain for more than 15 days.
That's where the parents need to be on the lookout, and there are ways that parents can talk to the teachers about lessening the load, lessening the amount of things that children have to carry back and forth to school, and then kind of monitoring what the kids are carrying. Are they taking things that they don't need, or other things from home that aren't necessary at school?
Now, the folks at Delmarva Chiropractic, they say they are trained in pediatric chiropractic. So if you should, or your little one should get injured, well, they can help take care of those injuries.
Yeah, because you don't want back pain to last into the adulthood. Absolutely. Well, something else that can plague our children this time of year, creepy, crawly lice. But do you really know how it's spread? Up next, we get the lowdown on lice, including how to tell if your child may have an infestation of the little buggers.
And if your child should come home with lice, no big deal, right? You just treat it and move on. But what if the lice didn't respond to the treatment? Mutated lice are causing quite a few headaches among parents. We'll learn about how it and how you can stop it.
But first, we've been talking a lot about keeping our back in check. Dr. Oz has more on lifestyle changes we can make to prevent pain.
Hi, I'm Dr. Oz. 4 out of 5 Americans will experience low back pain at some point in their lives. Here's how to keep it at bay. Keep your core strong with exercises like planks and crunches. Maintain proper posture when seated and standing. And try to avoid sleeping on your stomach. This position puts the most strain on your back.